Okay, everyone, we're going to get started. 30 minutes, one question, one follow-up, and I'll turn it over to the doctors now.
Yes, good afternoon. And because it's a short week, we're partway through the week, and dealing with the long weekend impact on lab testing and results, etc. And you're going to hear from Dr. Yaffe that the number of tests are up, which is what we usually see after a long weekend when it dips and goes back up again. In that, and we'll have some other comments to make in that regard as we deal with that. We heard from the Premier today that some of the recommendations from our public health measures table and from my office on the use of non-medical face coverings, or masks as they're called, has come forward, and we'll be commenting further on that after we get through the daily numbers and how we're proceeding in that regard as well. So I'm going to ask first for Dr. Yaffe to go through the numbers, and then we'll make some comments afterwards. So over to you, Dr. Yaffe.
Okay, thank you. Good afternoon. Today we have a total of 23,774 confirmed cases of COVID-19 reported in Ontario. This represents an increase of 1.7% or 390 cases compared to yesterday. Almost 57% of our cases are female, 42% are 60 years of age or older, and over 63% reside in the Greater Toronto Area. 17% or 4,111 of our cases are healthcare workers. Again, this is a cumulative number. It doesn't represent those currently positive. We do continue to see Ontarians recovering from COVID-19. At this point, almost 77% or 18,190 are considered resolved. Currently, 991 people are in hospital with COVID-19. Of these, 160 are in the ICU, and of those, 120 are on a ventilator. And tragically, we do continue to see deaths related to COVID-19. To date, 1,962 deaths have been reported, and this includes an increase of 43 deaths from the previous report. With respect to long-term care homes, according to IFIS, the Integrated Public Health Information System, we have 219 outbreaks that are active currently in long-term care homes. Cumulatively, we have had a total of 4,518 confirmed cases in residents, 1,573 cases in staff. And this includes 1,224 deaths in residents and 4 deaths reported in IFIS in healthcare workers. With respect to retirement homes, according to the information from the Ministry of Seniors and Accessibility, which is provided by the Retirement Homes Regulatory Authority, 65 retirement homes are in outbreak, with 181 deaths reported in the residents. In terms of laboratory tests, we have completed in Ontario 567,176 tests. In the last day, 7,382 tests have been completed, and 4,444 are currently under investigation. I'll turn it back to Dr. Williams.
Well, thank you. And as you can see, the laboratory testing has gone up from 5 to over 7,000 tests there, and the positivity rate, where it went up to 8, is back down to 6. So, and generally, the more testing you're doing, rather than just selective small areas, and that the testing percentage can vary widely, and we want is the overall percentage in there, and that was impacted before by our survey of our long-term care facilities, which has pretty well worked its way through the laboratory system, and we're trying to finalize all those and get that data put into the overall survey results. And still dealing with the long-term care homes, of course, if there's a further outbreak and need for further testing, that would be done. Same as with retirement homes and other congregate settings, public health units are and will be undertaking laboratory testing in those facilities if there is a risk factor identified, an outbreak, or other aspects accordingly. And I know that I've talked to a number of them, and they still are and will continue to do that on a needs base as they investigate and try to contain any outbreak in those facilities. The testing, as we're trying to differentiate between what we call the outbreak numbers, the long-term care, and those that have been identified clearly attached to a contact or a case, as compared to ones that are out in the community writ large. We're trying to work on that number, on that community-based one, which is what you have been asking about, and we've seen that still coming in. In the past, most of the outbreak ones were basically about 50-55%, and the other ones are 45%. As we're seeing it shifting, knowing that the data still has to come in as cases, and then some may actually be identified as outbreak numbers, some may be identified as case contacts, and they'll be moved over to the other one. Ideally, I'd like to see that number dropping down low in the long term as public health addresses all the cases in the community being either related to an outbreak, related to a case contact, or epidemiologically linked. But that's what our direction is, to try and address that. Those numbers tend to have been in the low 100s, and we're seeing a bit more rise at the moment, but we'll watch that in that perspective there. And again, so the numbers are always, what we're trying to do is get the direction of the trends and direction over time. So as I said, even though it has ups and downs, the trend direction was coming down in that, with some blips in there of the overall numbers. The positivity rate was coming down until we had some small selection of some high groups, and that bumped it up. But again, what's the overall trend? What's the trend on our cases being identified? So we hope to get that more readily available to you, so we can give you an idea of how we're faring in this 2-week period, which is stage 1 of phase 2, and we want to see on our overall population wide, how is it trending and how are we doing as a province, knowing that we may have some issues in certain areas of the province. And is that a outbreak? Is it contained, or is it containable, and how we're going to handle that? So there's a number of factors are raised in there as we watch and see how we're doing over the next 2 to 3 weeks. We brought in the masking aspect there because as we are now allowing more things out and around, people have more reasons to be out and around. Some are returning back to some workplaces, retail and otherwise, as they've opened up their facility, still respecting the 6-foot distancing, the 2 meter, still respecting. Sometimes some inside retail centers that can't guarantee that are requiring patrons to wait their turn in lineups outside, or to call ahead for still curbside pickup to avoid crowds. And sometimes some are requiring the use of non-medical face covering to be utilized within the facility, and that's fully within their prerogative. We have now put it out there that as people are going to be utilizing perhaps more public settings, as in going to and from their workplace, or going to from a retail center to pick up their material curbside or otherwise, there may be more usage in certain situations, such as transit, where you cannot be assured that you'll be able to guarantee that 2 meter or 6-foot distance. And we are recommending, strongly recommending, the use of facial covering, non-medical, in that time, so as to prevent any further transmission to others and to respect their space as well as your space in that regard. So that is our recommendation at the moment, with strong recommendation to use it in those settings there in that regard. And as I said, even when I was walking over to the office this morning, I was wearing my facial covering, because you have to walk the talk, as the saying is, in that regard. And as you get more and more people out, it may be more and more difficult to avoid a lot of close contact with people, and to be extra cautionary in that regard. So that's the general numbers there. It's still early in this next period of time. We're still coming out of the long weekend. We're still trying to look at our messaging for the public to go to assessment centers, to make sure that we're not putting up any barriers, so that if you feel you have symptoms that are compatible with COVID-19, or you're not sure if it's compatible or not, we'd like to try and facilitate that you would get to an assessment center at a time that's convenient with you, and to avoid large crowds at assessment centers, but to get assessed and get tested after being assessed by the center, and to see if it can be done. So we understand there still are some barriers in there, and we're trying to look at overcoming those, and to make it more readily available to the public writ large in that regard. So we hope to see those numbers to continue to increase. At least the ones going to get testing and getting assessed would be very helpful as we try to ascertain our overall population, I would say, prevalence or incidence of COVID-19 at this time, before we have any serological testing approved and carried forward for that purpose on a different line. So with that, I'm going to open up for questions from the media. So thank you.
Okay, we'll move to the phone lines.
First question comes from Mike Crawley from CBC News. Please go ahead. Hi, Dr. Williams. On testing, in his news briefing today, Premier Ford said we're going to ramp up this testing like this province has never seen. Another 3-4 weeks, we're going to do a lot of testing. I'm wondering if you could provide some details about this. For instance, how many tests daily are going to be conducted, and how you're going to get to that capacity, and how the testing strategy is going to evolve in this 3 to 4 week period?
Right, and I think your term evolve and testing strategy are both critical parts of that. So when we're doing that, as we said, our first phase was to complete the survey of the long-term care facilities, not that we wouldn't go back and test some others if and when necessary, and directed by the IMS group and work with the Ministry of Long-Term Care. And the same, as I said, there's ongoing aspects of where public health will identify ongoing outbreaks and do that testing. So we have to allow that capacity to be there, as well as make sure that we can get the priority groups done in a timely fashion so they're not delayed, so there's a big backlog. We do have the capacity to enhance it considerably, and we're looking at its strategy to say, how would we best utilize that resource, knowing that our first step was to open up for the public testing, not just ones with significant disease, but ones with even mild symptoms compatible with a wider list of symptoms and signs indicative of a potential COVID-19 case. And so then we open that up. We now understand there may be some further barriers where people are unsure how to get there, where to go. They're being told they still have to go through some other means to do that. So we're trying to look at removing those barriers so there's much greater public access to those sites to see what is really the public demand in that regard. There was some concerns if we open it up totally, would we get more than we could handle. Over the weekend, we did not see that. And so we'd like to make sure that, one, the public have had the full availability and capacity to go there without hindrance and without barriers. So we're trying to address and remove all those as possible, improve our communications. And then strategically, our table is looking at what other ones should we do? What kind of Sentinel testing can we do? What kind of other methods to make sure we can continue to assess the incidence of COVID-19 in our population? Notice I said the incidence because it only gets you what that person has at that moment if they're positive. It doesn't give you a prevalence study. I know it's a bit of jargon, or what is the immunity among the population. That has to wait for a serological test. So we do want to increase our testing, and we do want to use that to drive our overall knowledge and base of the ongoing transmission within the province of Ontario, or the success on the other side of our ongoing public health measures to limit that transmission and therefore make it more and more safe for public to go to different stages of our recovery phases. And so we need to do that, and that's something that the Premier is addressing, to make sure we have enough testing done so that we can, with confidence, move to any future levels of stepping up to the recovery program as outlined in the document that was tabled a month ago.
Follow up?
In relation to the statements today about wearing masks on public transit, could you tell me, what is the risk of spreading or contracting COVID-19 on public transit?
So the answer is, do we really know? Has someone done a study on that? We don't know. I haven't seen any international studies on what is public transit. We have tried to look at some of the other countries that have opened up on that. A lot of them have very much limited usage at this time because they're in about some of the same phases as we are with restricting use and amount of public access outside. So you're asking public transit with everybody separated by 6 feet, public transit with everybody wearing facial coverings, public transit within the old style, sometimes people jammed in face-to-face for half an hour. We do not want to see that repeated. So the new norm will not be like the old. And so we haven't seen a lot of ones that have really tested that and done any study on that. But we're waiting to be advised by any further evidence and science that may add to that and give us some further direction. But I have not seen any studies specifically in the wide variety of public transit, except to say that in those close proximity, without a distance and without some barrier, it would be biologically plausible that you're increasing the potential for transmission. And so therefore, we are putting these recommendations in place.
Next question.
Next question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Doctor. Just wanted to follow up on something that the Health Minister, Christine Elliott, was saying this morning in question period. She was talking about the need for more testing as well, and was acknowledging that people are nervous about going back to work and more exposure to others. She said, "We're working with businesses to determine how they are going to do their own testing. It is a complicated process." So what is in mind for businesses and testing? Are companies going to be doing their own testing outside the provincial lab system, or is this within the provincial lab system?
As far as I know, what we're trying to look at now, if you have large companies with employees that have to be in a physical site, there are some that are doing some method of, sending certain staff in at certain times. Some have certain methods of assessment. That means employee assessment when they come to the workplace. They may be using the same term as testing, as in I heard some are doing temperature checks, which we have always had some question about its value, asking them questions about, have you had any cases, any symptoms, just like we do here, have you answered a number of questions. So in a way, we're testing to see people coming in the place. We're not actually performing a test per se. It doesn't rule out that there could be some companies that might want to entertain doing some testing on like a Sentinel type basis, but as of yet we haven't implemented in particular, but we could entertain to do that to see if that was helpful in conjunction with some of the larger firms and companies that may want to do that. But we have our public testing program, and if they want to implement some methods, like some have tried to use the point of care testing technology in some regards, but I have not been approached by any company in particular yet, but I've heard some companies are interested in working with the local public health to ensure a safe return to work program, which combines a variety of things in personal protective equipment, spacing, distancing, and monitoring people coming into the office for any signs and symptoms, as well as history of contact, exposure, etc. So that would be my perspective on maybe what was mean by that kind of testing, but specific ones using actually laboratory testing, we haven't seen yet, but some are talking about even using serology in the future.
Follow up?
Okay, thank you. Just to follow up, is there any more thought to going into specific industries and testing workers there on a Sentinel basis? And I'm thinking particularly, like I've asked before, about grocery store workers and limo drivers, things like that.
Dr. Yaffe is interested in Sentinel testing.
I think that is something we're looking at, considering. I think it's important to do Sentinel testing, and which groups are the best to do that, and what kind of arrangements could be made. So we haven't sorted that out yet, but it's something for consideration. But certainly if we get a case in a workplace, then generally speaking, the public health unit would work with the workplace to get probably everyone tested in that workplace, and that has happened.
Next question.
Next question comes from Cynthia Melican from City News. Please go ahead.
Hello, doctor. I've been tracking the 5-day rolling average, and what I see is that it's been going up moderately and slowly, but it's still up from, say, a week ago. And as well as that, the new cases are outnumbering recovered cases the last few days. Are you concerned that we're going backwards? Are we seeing maybe the start of the curve reversing? Are we going to a bimodal model, like a second mound?
So, yes, you're doing the number crunching as you often do and looking at it, and whether it's a 5-day or a 1 week and the average over that time and the trend direction. So that's why we're hoping to give you some trends on that. I think the numbers, because it did go up, we're looking at that very eagerly at this time to say, is it really a significant change in that, as well as we've seen the overall change from our survey data and that integrating in there. So I would say at the moment, because it hasn't come down as quickly as I would like, that's why I want to be cautious on our removal of large-scale aspects in our measures in stage 1. We haven't said anything yet on that, and so we want to be cautious and observe to see what's happening. Also, are the cases we're seeing, is it increasing throughout the province, or is it happening more in certain areas? And it seems to be focusing more in some areas than others. So we still want to observe and do some more granular analysis of this matter.
Follow up?
My other question is last week it seemed that you were hinting that perhaps we might see some movement on increasing the gatherings from, say, 5 to 10, and perhaps allowing an expansion of the family bubble. The Premier today indicated that the gap was not, or the gathering was not going to be increased beyond 5. Is that because of the numbers that we've just discussed? And what about the family bubbles? Is that on pause?
I would say that the gathering one, certainly because of what we're seeing, is not being considered enhanced at this time beyond what we have at the moment. I think the concept of the bubbling and that we've seen some of the other provinces and territories dealing with, we are looking at some aspects of how, if we did that in Ontario, how would we do that? And we're still walking that through our various levels of consideration and discussion, as well as asking our experts to give us data and analysis on how does that affect our overall potential of transmission, how can we reduce that, keep that down. In a way, can we do it in certain ways that doesn't increase back up our so-called R0 rate of transmission, because we have gotten it down to below 0.9 a little bit, and we want to watch that very carefully so that if we're doing things, can we keep that down and keep it dropping down? And therefore, large public gatherings is not really on the table at the moment, but the other side, we have to look at it. How would we do it in a way that is consistent with the data and information that would support an ongoing containment model, a better improved case contact management model? And so we're walking that through right now, and we may have something more to announce on that in the near future, but we're still working that through different levels of consideration and discussion at this time.
Next question.
Next question comes from Christina Tenaglia from CP24. Please go ahead.
Hi, Dr. Williams. Hi, Dr. Yaffe. On the announcement of masks today, I'm wondering if you anticipate that you may be recommending, from the information you have now, a recommendation for masks in stage 2 or 3 as more businesses, stores, workplaces reopen in the economy.
Okay. You want to answer that, Dr. Yaffe, or myself, or both?
I'll start.
Okay, thank you. First over to you.
I think at this point, the recommendations that we had at the beginning still hold around hand washing, cough etiquette, don't go out if you're sick. Now we're adding the recommendation, as we go into the stage 1 of, if you're going to go out, and people are going to go out more at this point, and you're not sure you can maintain the 2-meter distance, wear the cloth mask. So my presumption is that that probably that recommendation will continue, but of course we're monitoring the evidence and the science around this infection, which is emerging, and we're monitoring the data, and we'll, if we have to modify the recommendation, we will. But I would say at this point it will continue.
Follow up.
For a follow up, Dr. Williams and Dr. I'm sorry, one second. It sounds like I'm hearing an echo here. Let me start again. Dr. Williams and Dr. Yaffe, I'd asked you last week about families who have been telling me that they haven't seen their parents or grandparents in long-term care homes in about 2 months now, due to the guidelines set out by Dr. Williams that non-essential visitors are not permitted in these homes. Obviously, some homes don't have an outbreak. I know you mentioned you were taking a look at this as to if there could be some easing of these restrictions in terms of families visiting their loved ones in these homes, particularly if a home doesn't have an outbreak. Just wondering, how close are you getting to easing that restriction? Is it something families can anticipate soon?
Yes, it's something that for a long period now I've been very concerned about, because having had family members in long-term care facilities, that kind of prolonged limitation has an effect, an impact. And we've been looking at how soon we could put in some changes to our visitor status guidelines with some protection aspects in there to allow more family members in, to give that extra real family contact, and it's so valuable and essential, especially ones with certain conditions, and it's been a long time. So I've been pushing that for a while, but we've been watching the direction of the IMS group, who have been dealing with the Ministry of Long-Term Care with the large outbreaks in our long-term care facilities, where there has been, unfortunately, a lot of impact, and as well as deaths still ongoing, sadly enough, in there, including a lot of healthcare workers impacted as well. So they have been naturally very cautious, but at the same time feel the pressure also, because there's a balance in here of the proper levels there. So I think as they're getting more and more success of moving homes from the so-called red category to yellow and green, there may be some more potential to say, okay, in some, there could be some opening up on that in there. So I know they're eagerly looking at that, trying to say as soon as they can, without putting more people at risk, because some of the times where the people are coming from, there is still, as we talked about the numbers today, with 390, there's still numbers out in the community. So how do you make sure you're not going to bring it back in again and even have more sequelae and more deaths? So it's a really tight balance, and I know they feel the same as I do, that it would really be great to get the families back in there with precautions and steps and care to allow that value-added visit from the family in there. And no one wants it more than we do, except the family themselves. They really want it desperately, and so we'd like to be able to entertain that as soon as we can when it's safe, because we don't want to put the others back at risk again. And I think we're getting closer, but I'll have to wait for direction from the long-term care ministry as well as the IMS table that's dealing with the ongoing outbreaks in the long-term care system.
Next question.
Next question comes from Siobhan Morris from News Talk 1010. Please go ahead.
Hi, Dr. Williams and Yaffe. News Talk 1010 has spoken with a doctor who believes that we're essentially guaranteeing a second wave by not investing more into testing and radically expanding the criteria that you've already expanded. Do you think that's a fair charge?
So I'll make my comments first, and Dr. Yaffe, if he wants to add some there. I think the question there is really raising, if you're going to have a secondary wave, the concept there is that if there's going to be an increase back in the community of COVID-19 cases, we're not out of the first wave. So to have a secondary wave in the middle of a first wave is like in the same group. So I can't say we're there yet. We'd like to be in a situation where you could entertain that you might have to anticipate a second wave. I'm saying that because we hope to get that number down over the summer, and usually with these respiratory viruses, they tend to abate to some extent over the summer months. They don't go totally away, and we don't know what its prevalence and movement around. Things like borders, access, public movement, etc. These all add to the risk factors of a secondary wave. So testing itself, if you do a lot of testing and you open up the borders and let people travel freely and everybody abandons personal protective, then you're just asking for it. Your testing is not going to help you. Testing matched with public health measures, matched with personal protective equipment, matched with infection prevention control practices is what's necessary. Testing just for the sake of testing and doing nothing with it doesn't really actually preclude a secondary wave. You're going to have to say you're going to test and monitor, detect it early, and then reinstitute steps and stages to either prevent a secondary wave or to mitigate it, or we talk in public health, to contain it, so that if it's not a wave, it happens to be some flare-ups in institutions and outbreaks that you can control. So in a way, testing is an adjunct, and it's important to do that, but you're going to have to do a lot more than just test if you're going to prevent a secondary wave.
Follow-up?
Just about the capacity question that we're not meeting. You know, you talked about there being an increase from the weekend, but we're still well below the threshold. So can you talk more about why it is that we're not seeing the number of tests that we're able to perform? And given that, would it make sense to double back on maybe vulnerable populations and test again at long-term care homes?
Yeah, I'll let you go with that, Dr. Yaffe. Mm-hmm.
To me, there's sort of three categories of testing. Obviously, if there's a case, testing the contacts. If there's a potential outbreak, testing the people who may have been exposed, whether they're symptomatic or not. So that's important. Then there's the routine testing, or what I call routine testing, which is anybody who has any of the symptoms that may be COVID-19. And that's where we're really trying to more strongly encourage people to get tested, to go to the assessment centers. And we're looking right now at any potential barriers around if people have to check first with telehealth or whatever, and being able to call or make an appointment and get to an assessment center and get tested. And then the third category, which is like this more surveillance kind of testing that we just completed in long-term care, and learning from that and potentially looking at other congregate settings. So I think the testing strategy is still in development and being encouraged. And certainly I think for the members of the public, it's very important if you have any of the symptoms, either call your doctor, telehealth, or if you can access your assessment center locally to get tested.
Okay, we're going to move to the last reporter.
Last question comes from Sabrina Nanji from Queen's Park Today. Please go ahead.
Hi, doctors. The Premier has said he's been getting lobbied, and I'm wondering if you, Dr. Williams, have felt any of that. Have you felt political pressure during this pandemic at all?
You should use the word lobbied, or now you're using the word political pressure. Could you be clear on what you're asking?
Sorry, I guess I just wanted to follow up. The Premier had talked about how he's getting lobbied and, hearing from people about the reopening. So I was just wondering if you felt any of that, maybe not necessarily from a lobbyist per se, but have you felt political pressure during this pandemic?
Well, I get lots of emails, lots of letters and different things from different groups that are individuals who are advocating for a certain perspective. So sometimes well over 20,000 different ones on that. So there are people, of course, it's unprecedented times, and it's been very stressful for a number of people who represent a wide variety of different interests and concerns. And we've been trying to correspond back and trying to be understanding of those perspectives. So the fact is that do I receive emails and interest, and people have strong opinions about why it's going to left or right. Some saying already you're opening up too much, you're not opening up enough. Some this is center and that center. That's just part of what testing and understanding what the issue is. So those comments are not irrelevant. They're all important to put in the overall balance, and we try to respond to those as best we can in the circumstances, because people are invested in it, people are concerned in it, people are being impacted by it, and they have strong feelings about that. I'm not sure whether there's actual lobby, but there are certain groups and sectors that represent a wider sector that write as well. So that's just part of the process when you're dealing with a large public health event, such as pandemic, where we haven't experienced such an extreme level of change for public. But that's just part of being attention and listening to the public and responding as best you can and trying to deal with their concerns and issues in a timely fashion.
Follow up, and this is the last question.
Yeah, just to follow up on that really quickly, can you give us examples or tell us what groups you've been hearing from?
Well, I can't tell you all the different ones. There's a wide variety. Some I didn't know about. Some are interesting. There's individuals who have very personal perspectives on matter, different aspects in there. So I would say, I don't think there's hardly any group that we haven't heard from, but I wouldn't say it's comprehensive. There's probably more we're going to hear from now. At least the golfers have eased off now that the golf courses are open, and some of the others in that aspect there. So because the open the golf course, it wasn't a direct one from myself, but I heard they were interested. There's others have other areas of topics, just like we talked about before. There's many family members want to have more visitation at long-term care facilities. I understand their plight and their anxiety about not being able to do that, and we're trying to work with that as best we can. So there's people, there's individuals, there's some from the north, different sectors, and various ones interested in offering their opinion and assistance. So there's a wide variety. I wouldn't say I could go through any list of anyone in particular, but none of them are rejected outright. No.
Okay, thank you.